Hello and welcome to Psych News Today. I am your host, Audrey Graham, and today we will be discussing the effects of screen time on children between the ages of 1 and 4. This research can benefit busy parents who need help knowing why screens are not the best option and how parents can involve their children in their daily activities instead of distracting them with screens. According to a 2023 study performed by Rich Tell, babies who were exposed to the highest levels of screen time were children of young parents, first-time mothers, low income and household education levels, or mothers suffering from postpartum depression. If this describes you, don't feel bad. Many parents may be unaware of the negative developmental effects associated with high levels of screen time, which can lead to developmental delays across numerous domains. However, not all parents have the privilege to interact face-to-face with their baby consistently. This research is intended to help parents understand how screen time can affect their children's future development and find new ways of interacting with and entertaining a baby that does not involve screen time. For starters, children's development can be measured across multiple domains. Takahashi et al. Studied the dose-response association between screen time exposure at 1 year of age and 5 domains of developmental delays at ages 2 and 4. These 5 domains included communication, gross motor, fine motor, problem solving, and personal and social skills. Takahashi et al. Found that greater screen time was associated with developmental delays across all domains, but those children who were exposed to an average of 4 hours of screen time or more per day experienced significantly more developmental delays in communication and problem-solving skills at ages 2 and 4 years. In another study performed by MacArthur et al. In 2022, authors found corresponding results when they examined the association between hours of screen time and children's developmental and behavioral outcomes. In the study, 4 domains were assessed: physical aggression, emotional disorder/anxiety, and separation anxiety. MacArthur et al. Found that children who were exposed to screens for 2 hours or more a day experienced increased behavioral problems, delayed achievement of milestones, and poorer vocabulary development. So far, research has supported Jean Piaget's theory of cognitive development, in which children at this age are in the sensory motor stage and are actively working as little scientists to learn about the world around them. Piaget theorized that infants learn primarily through direct interactions with their parents, environment, and the objects around them. Screen time inhibits the ability of infants to learn directly, leading to delayed and protracted development. To continue, Suppanathayanan et al. Examined the association between the age of onset of media exposure, the cumulative effect of high media exposure, and verbal interaction during screen time in the first 2 years of life to determine its impact on 4-year-old cognition. The authors found that introducing screens and verbal interaction during screen time during the first 2 years of life was associated with better cognitive development. These findings show that screens are not inherently negative for your kids, but including verbal interaction during screen time can be beneficial to language development and influence positive cognitive development. These findings further support Piaget's theory that children will learn through direct interaction. In a 2021 study by Berrigan-Jason et al., the authors examined the association between screen time exposure, delayed gratification, and social integration by exposing students between the ages of 4 and 6 to screen time for different amounts of time to measure patience and social interaction. Within the study, children performed 2 tasks in which delayed gratification was measured by asking the child 2 questions. Berrigan-Jason et al. Found that children with higher screen exposure had worse social integration in school and were less likely to show patience. Further, not only can screen time affect behavior, but also the inhibitory control network, or the ICN. Chen et al. In 2023 studied the association between screen exposure and children's ICN. For background, the behavioral inhibition system corresponds to motivation to avoid aversive outcomes, and the behavioral activation system corresponds to motivation to gain rewards. The authors found that longer periods of screen time are negatively associated with the strength of the frontostriatal circuitry, which involves motor and cognitive functions, leading to prolonged development of the ICN. This evidence further supports the idea that high screen time levels will lead to developmental delays, but also suggests high screen time can lead to protracted development of the ICN. Kisafalu et al. In 2024 examined the relationship between watching fantastical content and the development of executive functioning skills. Children were shown either a clip of a fantastical or non-fantastical show. The following test included 4 tasks: the backward word span task, which measured working memory, the Simon Says task, which measured inhibitory control, the flexible item selection task, which measures cognitive flexibility, and the children's 2D mental transformation task, which measures mental rotation skills. The authors found that children who watched the fantastical cartoon performed worse on working memory and inhibitory control tasks than children who watched the non-fantastical show. This evidence further supports previous research, which states that screen use will prevent the development of the ICN. Finally, Gwynns et al. Examined the pre, peri, and postnatal factors and screen time in patients with autism spectrum disorder to evaluate risk factors specifically for people with ASD. The authors found that prenatal maternal psychological stress, prenatal and postpartum depression, and excess screen exposure may be related to an increased risk for ASD. This evidence brings in new research that adds to the negative effects of screen time on babies, with numerous other factors influencing it. Ultimately, the most important aspect, especially for busy parents, is to find balance and be in control as much as possible. Screen time is not inherently going to negatively affect a child as long as there is a limit. Although screen time scores were highest among a specific demographic of parents, finding ways to control what, when, where, and how much screen time their child receives will leave lasting benefits. It is important to remember that face-to-face interactions are a privilege that not all parents have, and keeping children away from screens require a lot of patience, energy, and willpower. One suggestion is to ask whoever can help before relying on screens. Although not everyone has the privilege of living near family or friends, asking a family member or trusted friend to interact with your child to distract them will give an exhausted parent a much-needed break and allow for communication between the baby and multiple caregivers. Face-to-face interaction during the first 2 years of life is crucial in forming the foundation for language and communication skills. Another way to avoid high screen time levels during infancy is to learn rhymes, songs, and dances that distract a baby. Although reciting a story or song to a baby face-to-face would be most beneficial, if a parent needs a distraction for their child, performing a dance or song multitasking, such as dancing in front of a baby while mopping the floor, can provide a middle ground that allows for parents to be productive without risking their child's developmental health. Research on screen time and developmental delays can apply to multiple domains, but focuses on cognitive development and executive. Research on screen time and developmental delays can apply to multiple domains, but focuses on cognitive development and executive functioning skills. Piaget discussed the 6 substages of sensory motor development in which infants learn about the world through their senses and motor abilities, which provide a foundation for cognitive development. Once a child is 2 years old and has entered Piaget's pre-operational stage of development, pretend play and symbols represent words, images, and ideas. These are 2 crucial stages for infants forming language, communication, and other executive functioning skills, which is why screen time can negatively affect future cognitive development. Face-to-face interactions between caregivers and infants are important in forming these connections.